According to the United Nations, approximately 1 billion people across the world are still forced to defecate in public. Although this figure has significantly decreased since 1990, it continues to be a major factor in the spread of fatal diseases such as cholera and typhoid. In sub-Saharan Africa alone, 39 million did not have access to toilets in 2012. A new report released by the World Health Organization and UNICEF revealed that since 1990, about 2 billion people around the world have gained access to improved water and sanitation. 2.3 billion now have access to drinking water from improved sources. The report, titled Progress on Drinking Water and Sanitation 2014 Update, also highlights a narrowing disparity in access to cleaner water and better sanitation between rural and urban areas.
8 out of 10 people without access to an improved water source are still living in rural areas. And within urban areas, we're seeing, for example, also on drinking water, we're seeing that many of the poor people in cities have no choice but to access water in sort of ad hoc ways through pay-per-go kiosks, while the wealthy are able to access their water through a piped into the home system.
In 1990, 95% of people in urban areas could drink improved water, compared with 62% of people in rural areas. By 2012, 96% of people living in towns and 82% of those in rural areas had access to improved water. Despite the progress, sharp geographic, social, cultural and economic inequalities in access to improved drinking water and sanitation facilities still persist around the world. The practice is still increasing in 26 countries in sub-Saharan Africa. Nigeria was the worst offender, with 39 million open defecators in 2012 compared to 23 million in 1990. In the Democratic Republic of Congo, 14% of the population are open defecators. The UN says the practice is unacceptable and plans to eliminate it by 2025.
We're tremendously concerned with sanitation. We're seeing that progress seems to be stopped at about 2.5 billion people, which we saw in the last report as well. But more concerning is that 1 billion people of those 2.5 have no choice but to openly defecate. So these are people that are going sort of to the bathroom in fields, in bushes, along gutters, on roadsides, which is really causing a health hazard.
Globally, India has the largest number of people, more than 597 million people still defecating in the open. Meanwhile, the report by the WHO and UNICEF shows that 1,400 children, many of them in Africa, die each day from a lack of clean water. Efforts to improve sanitation in poor countries has so far concentrated on building more latrines, the UN said, but many people don't want to use them. Other suggestions to reduce public defecation include creating monitoring processes.
Overall, we've got to do something about these populations that are hidden in the corners, about the vulnerable and the marginalized. So unless countries start putting together monitoring processes to understand where people are getting their water and where they aren't, who's getting them, are finances going in the right direction?
In India, an ad campaign is using a giant stool called Mr. Pooh that chases people to the toilets to encourage children to use the toilets. In a country where only half of the population uses toilets, UNICEF wants to tackle public health head on.